Can 30 minutes a day really change diabetes? Here's what science is revealing. What if managing diabetes don't always start with a pill? What if something as simple as moving your body for just 30 minutes a day could actually lower blood sugar and even reduce the need for medication? Sounds surprising, right? Today, we are diving into a growing shift in diabetes care, one that's making doctors look beyond prescriptions and toward something much more accessible. A new way of looking at diabetes. For years, diabetes management has mostly focused on medications, insulin, and strict monitoring. But now, health experts are emphasizing something different: movement, not intense workout, not complicated routines, just consistent daily physical activity. But here's the real question: can something this simple actually make a measurable difference? What happens inside your body when you move? When you start moving, whether it's walking, cycling, or swimming, your muscles being using glucose for energy. That means less sugar stays in your blood stream. At the same time, your body becomes more responsive to insulin. This is important because insulin resistance is one of the main challenges is in type 2 diabetes. And here's something many people don't realize. The effects of a single season of exercise can last more than 24 hours. So it's not about the moment, it's about what continues happening inside your body long after you stop. Why 30 minutes is being recommended? Health experts commonly suggest around 30 minutes of activity per day, at least 5 days a week, or about 150 minutes weekly. The goal isn't intensity, it's consistency. Even something as simple as brisk walking can be enough to start seeing benefits. But here's where things get interesting. Can exercise reduce the need of medication? Some studies is and expert opinions suggest that regular physical activity can improve blood sugar control to the point where medication requirements may be reduced. But, and this is important, this does not happen for everyone, and it should never be done without medical guidance. So, here the idea sounds promising. It's not a one size fits all solution. It's not just about exercise alone. Even though movement plays a powerful role, it's only one part of the bigger picture. Diet, sleep, stress levels, and individual health conditions are influence how diabetes is managed. So the real approach is not replacing treatment, it's it's strengthening it. The bigger concern why this matters now. Diabetes cases are rising globally and not just among older adults. Suddenly, lifestyles, long hours of sitting, and reduced physical activity are becoming more common, especially among younger population. Which brings us back to a simple but powerful idea. Could small daily habits the could could small daily habits be the missing piece? Sorry. Before you start, a few things to keep in mind. Hill exercise is beneficial. Safety matters. Avoid sudden intense workouts. Monitor blood sugar level regularly. Stay hydrated. Stay hydrated. Don't exercise on an empty stomach. Protect your feet with proper footwear. These steps help prevent complications and make activity safer and more effective. So, what's the real takeaway? At the beginning, we asked, can 30 minutes a day really change diabetes? The answer isn't a simple yes or no, but here's what is advice. Evidence clearly shows regular movement, lower blood sugar. It improves insulin function and in some cases it may reduce dependence on medication, not by replacing treatment but by supporting it. Final thought. Sometimes the most powerful changes don't come from something complex but from something consistent, and in this case it might be as simple as getting up and moving every day. Thank you.